There are two deeper muscles that no one ever talks about that can be the entire reason for your TMJ. And in today's video, I'm going to be showing you how to release these damn muscles so you can finally feel some relief. Welcome to Training Massage. My name's Adam. And in today's video, I'm going to be giving you a step-by-step plan on how to relieve and maybe even get rid of your TMJ by using real self-massage techniques on the muscles deep in the jaw called the medial and lateral pterygoid. On top of that, you're also going to discover brand new techniques to release other muscles like the masseter and the temporalis. So if that sounds like something you're interested in, then make sure to smash that like and subscribe button. Not for the YouTube algorithm, okay, maybe a little bit, but mainly to finally feel some relief from your TMJ pain. Now before we dive into the deeper muscles, we must first target the more superficial muscles that can also create TMJ pain and discomfort, like the masseter, the temporalis, and even the SCM. And by the way, TMJ is part of TMD, which is temporal mandibular disorders, meaning the joint areas, the joint issues within the jawline is simply clustered into all the disorders that happen in that area as well. So we're going to start off by first releasing the SCM, followed by releasing the other muscles like the masseter and the temporalis, followed by finally getting into those deeper muscles, the pterygoids. Let's get into it. So the sternocleidomastoid muscle, or the SCM here, can create pain in the jawline area, one, because of trigger points that may refer pain in that area, and two, it may even create a misalignment in the jaw because of where it attaches to on the skull. Now, most likely your SCM is going to be tight because it is a very common muscle to be tight with people who have forward head posture, which is basically 90% of us these days thanks to our modern society. So massaging this muscle may not only help you with your TMJ pain, it may also even help with things like neck pain and even migraine headaches. Now there are several techniques we can do here in order to release the SCM. We're going to start off by first warming up the tissues for 30 to 60 seconds by creating a compression and decompression while we are moving up and down the muscle here. Now, as you do this, you can also gently peel the muscle towards the back as you're going up and down it, which will help open up the muscle a little more and prepare it for the next techniques. Now, this next one's pretty easy. We're going to be performing some static pressure in order to get rid of trigger points. So find the most tender spot within the neck area, within that muscle, and you're going to hold static pressure. You can basically do it by clamping down on it with your fingers, or by pressing into it with your fingers or even a tool here, and do this for about 30 seconds up to 2 minutes or until that pain begins to go away. Now, as you're targeting the SCM, try to release 1 to 3 trigger points before moving on. Next up, we're going to perform some stripping techniques. What you want to do is start at the top or the bottom of the muscle, and using medium pressure, strip the muscle going along the muscle fibers. Now you can use your fingers, you can use your knuckles, you can use a tool, and if your skin is dry, you might need to use some oil, some lotion, or some balm. Try to perform 5 to 10 slow, deep strokes with medium pressure before moving on. Now we're going to perform some cross friction, which is basically going across the muscle fibers. First step here is we want to grab our SCM very slightly and then rotate our head to the opposite direction. Now from here, we're going to pinch on and grab that SCM and hold on to it as we slowly rotate our head back to center and maybe even to the other side. Now while you're doing this, you should feel the muscle slowly slide underneath your fingers, which is a good thing because it's helping to strip the fascia. You can also do this by starting from the same side and then rotating over to the opposite side. Do this for about 30 to 60 seconds. Finally, let's do the full finger pull. Now I did just make that up real quick, so let me know in the comment section a better name after you've seen the technique. To perform this technique, start by dropping your ear to your shoulder, which will help stretch out the opposite side SCM. Now from here, take your opposite side arm, the side you're tilting your head to, reach around behind your neck and grab onto the front of the SCM muscle. This should be the muscle that is stretched out, by the way, not the same side muscle. Now from here, hold on to it and gently pull it back as you keep your head planted into your shoulder. What it should feel like is you're basically peeling the muscle towards the back, which again is going to help stretch it out a little bit, but also open up the fascia restrictions. Try to perform 5 to 10 slow stripping techniques before moving on. Now from here, go through it, but now work the other side. Now up next is the masseter, which is located on the side or on the jaw. And you can easily find it by simply clenching your teeth together, and the muscle that pops out in your cheeks is going to be your masseter. Now trigger points in this muscle may create pain in the upper and lower teeth and may even create a tooth sensitivity. And it may even create pain on the front of the face, under the eyes, or deep in the ears. Now there is a simple test we can do real quick to find out if the masseter is tight. All we have to do is simply stack 3 fingers on top of each other and then try to place them into our mouths. If it is easy to place them into your mouth, then most likely that masseter is not tight and probably doesn't have too many trigger points. And in case you're wondering, yes, this is a real test. It was first created in 1929 and then confirmed to be a reliable test in 2008. The first one we could do is warm up the tissues by simply pressing into the muscle and then out, creating light compression, which we can actually do for about 30 to 60 seconds. So up next, we're gonna perform some stripping techniques. Again, starting at the bottom or the top of the muscle and slowly going up or down it. All you wanna do is apply a little bit of pressure into it while you're doing this. Again, perform 5 to 10 strokes going in both directions with the fibers and performing cross friction going against the fibers. Now, while you're stripping, you can also target the areas between the muscles and the bones, which will help get rid of all that unwanted fascia in there and hopefully help that muscle contract and relax a little more independently when it needs to. And finally, we're going to perform some static pressure by doing a pinching motion on our masseter muscle. And in order to do this, we need to start by placing first one finger, which I recommend the index finger, into your mouth, and your thumb right here on the outside of it, which is going to grab the outside of the masseter. Now from here, you're simply going to squeeze onto the masseter and hold pressure for 30 seconds up to 2 minutes, or at least until the tender spot goes away. And while you're pinching this muscle, we can also gently contract and relax it by clenching the jaw slightly and then relaxing it, which might help you find other trigger points as well. Try to release at least 1 to 3 trigger points before you move on, and don't forget the other side. Next up is the temporalis, which is located just above the ear on the side of the head. Now when this muscle gets trigger points, it can end up creating pain in the front and the side of the head. It may end up creating pain in the tooth, very similar to the masseter, like a tooth sensitivity, and it may even create inflammation in the upper gums. To massage the temporalis, we can start by warming up the tissues for 30 to 60 seconds by performing small circular motions using our fingers and applying gentle pressure to the muscle. Now from here, perform your stripping techniques, once again going with the muscle fibers, applying a deep and slow pressure as you're doing this, and then go again cross friction going against the muscle fibers, doing 5 to 10 strokes per direction. And the final technique is going to be a basic static pressure. You can use your fingers or your knuckles, whatever tool you want to use, in order to apply static pressure to the most tender spot within the muscle, and then hold it there for 30 seconds up to 2 minutes, or until the pain goes away. Try to release at least 1 to 3 trigger points before moving on. Or if you're just lazy like me, you can use a lacrosse ball or any other small ball you have and just lay on your side to apply static pressure to the temporalis. Now finally, we reach one of the 2 deeper muscles that may be creating your TMJ, starting with the medial pterygoid. Now this muscle is located on the corner, on the inside of the jawline, and can be accessed by simply going underneath and pulling back into it. And when this muscle gets trigger points, it may create pain on the front of the ear, may create pain in the back of the throat, and it may even make it hard to swallow. Now there isn't much we can do to actually release this muscle because of how deep it is, but we can do a few things. And the first one is going to be static pressure. Simply using your thumb or your fingers, whichever one you want to use, You're gonna go into the corner of the jaw and you're gonna press up and into it in order to access the muscle. You're simply trying to kind of pinch your jaw here, but on the inside where your thumb is, that's going to be where the muscle is located. Now from here, you can simply apply static pressure for 30 seconds up to 2 minutes if you're able to locate a tender spot. Now we can also do this from different angles. I don't need to go directly from the corner. I can go a little bit from the back, I can go a little bit from the front, and I'm still trying to target that corner area though. I'm trying to go at it from a different angle. And finally, we can even perform a gentle pin and stretch here by simply grabbing onto that muscle in that area and then moving our jawline either laterally to the same side we're pinching or forward and back in order to help contract and relax that muscle. You're going to perform a pin and stretch while you're doing this. Try to do it for about 30 to 60 seconds. And once again, don't forget the other side. And the final muscle is the lateral pterygoid. Now, this muscle has been called the #1 reason for TMJ, mainly because the referred pain that it distributes goes directly onto the joint. Now, I'm not saying it is the #1 reason, I'm simply saying it's been called the #1 reason for TMJ. Now, in order to access this one, there are 2 ways, with the first one being inside the mouth. What we want to do here is using our pinky because we need a small finger basically. Now, if you have small fingers, then use whichever one you want, but for most of us, we want to use our pinky here. We want to stick it all the way into the back of our mouth, basically tracing the top of the gums. Now from here, we're going to end up hitting a little blockage. In order to bypass this in your mouth, all you have to do is gently deviate or laterally push your jaw to the same side you have your finger in. Now at this point, we should be past the gums. We shouldn't have any teeth back there. And what we want to do is simply follow our gums up and hook straight up into that tender area behind the gums. And this is most likely going to be our lateral pterygoid. And we can try to confirm this by simply protruding our jaw forward and pushing it to the same side, which then we should feel the muscles contract. Now don't stress too much if you're not able to find it by sticking your fingers in your mouth, because to be honest, not even doctors have been able to confirm this with palpation. Some doctors have been able to confirm it, some have not. But chances are, if we're not hitting the lateral pterygoid, then they say we are probably hitting the medial pterygoid just from a different angle. So regardless of which muscle we're hitting, it's still a win-win because these muscles are probably going to be tight anyways. Now another way we can access this muscle is by trying to target it from the outside. And the way we have to do this is by going through the masseter muscle. Now, if you have not released your masseter and it's full of trigger points, then chances are you're not going to be able to get deep into the lateral pterygoid area as well. But what we want to do here is after we've released the masseter, we want to apply gentle pressure into the masseter as the jaw is slightly open but not contracted. We want the jaw to be relaxed so the masseter is relaxed. Now from here, you're simply going to look for that little bony, that little hole in the cheek when the jaw is dropped, and we're going to apply static pressure into that area to try to hit that lateral pterygoid. Now, if you have trouble accessing that small hole using your fingers or even using your pinky, then try using an eraser from a pencil. The small thing is nice and solid, but not too hard, and it's small enough to access the hole between the jaw and the skull. So once you're able to access this muscle, we're now going to perform static pressure for 30 seconds up to 2 minutes, trying to hit at least 1 to 3 trigger points per muscle. And similar to the medial pterygoid, we can also perform a pin and stretch by, again, performing static pressure on that spot and then moving the jawline forward and to the same side you're working on, which will help contract and relax the muscle. Do that for, again, another 30 to 60 seconds. Now, one thing that does contribute to TMJ is forward head posture. And if that's something you want to work on, then click on the video in the top right. Or if you're someone who gets frequent migraine headaches and you want to get rid of it, then click on the video in the top left. That's it for this video. Thanks for watching, and I'll see you later.